Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today, we are going to speak about the Amniocentesis and the Chorionic Villus Sampling Guidelines. So, what are the objectives? To know about the Green Top Guideline published in October 2021 by the Royal College of Obstetricians and Gynecologists about the amniocentesis and the chorionic villus sampling. Okay, let us start with the gestational age. Which gestational age can be used for amniocentesis? Amniocentesis shouldn't be performed prior to 15 weeks gestation. And this is grade A recommendation, means the highest recommendation. Okay, so shouldn't be performed prior to 15 weeks gestation. So if I wanna do amniocentesis, I'll do it after 15 weeks gestational age. Okay, it is done guided by ultrasound, as you see in the picture, with needle. Aspirate sample of amniotic fluid for chromosomal karyotyping or genetic analysis for different disease. Chromosomal karyotyping as in aneuploidy, as in trisomy 21, Down syndrome, or trisomy 18. Also for many other indications like hemorrhagic disease, like RH isoimmunization, like alloimmunization, like intrauterine fetal blood transfusion. So it is done for many indications, okay? Diagnostic or therapeutic. Done after 15 weeks gestational age. What about chorionic villus sampling? Chorionic villus sampling shouldn't be performed prior to 10 weeks gestation, and this is grade D recommendation. As you see here, it is done by needle, guided by ultrasound, taking sample of chorionic villi for karyotyping and also genetic analysis. Okay, so to know if there is aneuploidy, for example, also, or any other chromosomal abnormalities, translocations, any other abnormalities, structural abnormalities, or numerical abnormalities. So it is very important to be diagnosed early in pregnancy. Okay, so the woman can take a decision about this pregnancy. Okay, but you should know that it shouldn't be performed prior to 10 weeks gestation. So after 10 weeks gestation, do it. Okay, usually between 11 and 13 weeks gestation age. Okay, okay, where possible, to reduce the risk of technical challenges, chorionic villus sampling should be performed from 11 weeks gestational age and onwards. Okay, so 11 weeks, as I said before, is better to reduce the risk of technical challenge. Okay, what about risk of miscarriage? Is there is risk of miscarriage? Okay, women should be informed that additional risk of miscarriage following amniocentesis or chorionic villus sampling performed by skilled operator is likely to be below 0.5%. And this is grade B recommendation. So the possibility of miscarriage after amniocentesis or chorionic villus sampling, if it is done by skilled operator, it is less than 0.5%. And this is grade B recommendation. Okay? Okay, what about multiple pregnancies? Okay, women with multiple pregnancies should be informed that the additional risk of miscarriage for twin pregnancy following chorionic villus sampling or amniocentesis performed by skilled operator is around 1%. And this is grade B recommendation. So, as you see, in multiple pregnancy like twin, the possibility of miscarriage is around 1%. But in single-tone pregnancy, the possibility of miscarriage is less than 0.5%. But in all situations, should be done by skilled operator. Okay? So the possibility of miscarriage more in twin pregnancy than in single-tone pregnancy, as you see. What about risks of mother to child transmission of infection? Possibility of transmission of infection, vertical transmission from mother to fetus during taking chorionic villus sampling or doing amniocentesis. Okay, screening result for blood-borne viruses, viral load and the antigen test results should be reviewed when an invasive test is considered, and the individualized risk of viral transmission should be discussed. And this is grade C recommendation. Means what? If there is need for chorionic villus sampling or amniocentesis, and both of them invasive procedure, you should have first the result of viral infection. Okay, if there is already known viral infection, I should know the viral load, because the higher the viral load, the higher the possibility of transmission of infection. Okay, so this is very important. Transmission from mother to the fetus, and this is grade C recommendation. Okay, what about if the mother has HIV, human immune deficiency virus infection? Okay, where screening results for blood-borne viruses are not known, here is the difference. I don't know if the woman has HIV or not. Okay, what I'm going to do, and I wanna do chorionic villus sampling or amniocentesis, I should delay the procedure until getting the result of HIV status. Okay, so it is mandatory to know if she is HIV positive or negative. And as you know, in the first antenatal care visit, one of the important investigations done is to do testing for HIV. Okay, so before doing amniocentesis, know the result of HIV. Is it positive or negative? If it is positive, you should know the viral load. Okay, and this is good practice point. Okay, what is next? Antiretroviral treatment should be optimized to aim for an undetectable viral load prior to amniocentesis or chorionic villus sampling. And this is grade C recommendation. So, if the woman is positive for HIV and receiving antiretroviral treatment, okay, this treatment should be optimized so the viral load reach undetectable level, okay, prior to amniocentesis or chorionic villus sampling, because this, if it is done in this situation, will reduce the risk of transmission from mother to the fetus. Okay, okay, what if the mother carrying hepatitis B? The risk of mother to child transmission of hepatitis B is low, with viral load less than 6.99 log 10 copies per ml, but increases with higher level viral loads. Okay, and this is grade C recommendation. So there is a possibility of transmission from mother to the fetus according to the viral load in case of hepatitis B. Okay, what about hepatitis C? There is no evidence of risk of mother to child transmission of hepatitis C based on limited data available, and this is grade C recommendation. So up till now, Although it is limited data, there is no evidence of risk of mother-to-child transmission of hepatitis C during chorionic villus sampling or amniocentesis. What about third trimester amniocentesis? The risk associated with third trimester diagnostic amniocentesis, including the risk of preterm labor, are likely to be low. And this is grade D recommendation. So, the risk of preterm labor is likely to be low if you did amniocentesis in third trimester, and this is grade D recommendation. What else important if you did third trimester amniocentesis? For any reason, for any indication. Women should be informed that there is higher risk of cell culture failure with amniocentesis performed in the third trimester. So, the risk of cell culture failure increases with the advancement of the pregnancy. You should know this. So, in third trimester, there is higher risk of cell culture failure with amniocentesis performed in this third trimester. Okay, and this is grade C recommendation. Lastly, what are the other risks that could be associated with amniocentesis and chorionic villus sampling? Is there possibility of severe infection, fetal injury, maternal visceral injury? In both amniocentesis and the chorionic villus sampling, severe infection, fetal injury, maternal visceral injury, all of them are rare complications. Are rare. Okay? Okay. What about second sampling or repeat procedure? In amniocentesis, up to 6% of cases it happens. While in chorionic villus sampling, also up to 6%. Okay? So equal in both of them the need of second sampling or repeating the procedure. Okay? This is another risk. What else? Blood stained sample. It may happen in amniocentesis in 0.8% of cases. Not applicable in chorionic villus sampling. What about confined placental mosaicism? Not applicable for amniocentesis and less than 2% in chorionic villus sampling. What about maternal cell contamination? 1 to 2% in amniocentesis, 1 to 2% in chorionic villus sampling. What about rapid test failure? It is equal in both amniocentesis and the chorionic villus sampling, 2% in each one, as regard the rapid test failure. What about failed cell culture? In amniocentesis, from 0.5 up to 1%, while in chorionic villus sampling, the same, 0.5 up to 1%. This is as regard failed cell culture. Okay? As I said before, severe infection as a complication of amniocentesis or chorionic villus sampling is rare in both amniocentesis and chorionic villus sampling. Fetal injury is a rare complication also in both. Maternal visceral injury is a rare complication in both, and this is grade D recommendation. This is the end of my lecture. I hope it was clear enough. This is my box published on Amazon. You can go there to find my box. Textbook of Obstetrics, textbook of Gynecology, contraception handbook, multiple choice question book, and the medical disorder in pregnancy book. This is my site on Amazon, and this is my site on YouTube, and my site on Blogspot. My best wishes for all of you.